Hi there, and thank you so much for the opportunity to present on our project titled Partnering with Young Adults in the Ready to Exit Study, Mixed Methods Doctoral Project. My name is Brooke Alamang, and I'm a PhD candidate in the Faculty of Social Work at the University of Calgary, and I'm joined by one of my co-presenters.
My name is Marcela Farias, and I'm one of the 5 young adult research partners on Brooke's amazing team. I graduated with a Bachelor's of Science in Neuroscience from Carleton University, and then I graduated from a postgraduate diploma program in Addictions and Mental Health Counseling at Humber College. I'm currently working as a youth and young adult addictions counselor with the Kids Come First Health Team of Ontario.
So over the next 15 minutes, we plan to review the Ready to Exit study and research design, and then describe the practices, processes, and outputs of young adult partnership and research as applied to this doctoral research project. We'll conclude with some preliminary findings, and we'll share some lessons learned about our first year partnering together in this work. By way of background, we know that the transition from pediatric to adult care is a high-risk period for youth with chronic health conditions. Youth often report feeling unprepared for this transition from one system to the next, and in fact, this period has been associated with poor health and psychosocial outcomes for youth. Interestingly, up to 57% of youth with chronic health conditions also experience mental health issues like depression and anxiety, the presence of which is associated with poor quality of life, longer hospital stays, and higher healthcare costs. Preparing youth for adult care by promoting transition readiness, or the development of health-related knowledge and self-management skills, has been identified as a facilitator to successful transition and is in fact associated with positive outcomes for youth. Problematically, however, transition readiness for youth with co-occurring health and mental health issues has not been explored. As such, Ready to Exit's research objective is to understand the transition readiness of youth with co-occurring chronic health and mental health issues in Alberta. And this work is guided by 2 questions. The first is a mental health issue associated with transition readiness in youth with chronic health conditions? And the second is, what are the experiences of youth as they're preparing to exit pediatric services? So on the slide here, you'll see Ready to Exit study design, which is a sequential, explanatory, mixed methods design that we're using to address our objectives. And this work is being conducted in collaboration with 5 young adult research partners, which you'll hear about shortly. This study uses a combination of survey data and qualitative interviews to enhance our understanding of youth transition readiness. In this presentation, we'll describe our processes of partnering in the Ready to Exit study and some preliminary results. So let's talk a bit about how the Young Adult Research Partner Group, or the YARP, was first developed. Prior to the establishment of this group, I held consultations with existing advisory councils in the province of Alberta to support priority setting and research question refinement in the early years of my doctoral work. In year 3 of my PhD, I was fortunate to receive a CIHR patient-oriented research grant to financially support the development of a project-specific patient partner council for Ready to Exit. I recruited 5 young adults with lived experience in the health and mental health systems across Canada to become involved in the YARP for a 1-year term. Onboarding interviews were conducted by phone or Zoom with members to understand their goals, motivations, and expectations for this group, and educational resources were provided to members on topics like research processes and patient engagement in research.
So as a YARP member, it was exciting to have our meetings begin. At the onset, we were given the space to share our intentions for joining that ranged from a passion about providing a true patient perspective in this realm of research to being able to act as partners in the research process to gain tangible research-based skills throughout. The YARP meets monthly via Zoom, where we all gather together with Brooke to discuss where the project is at and how our contributions are unfolding. Each of us are given the opportunity to co-chair the meeting and lead the check-in and check-out questions, which makes these meetings really fun. The overall best part of being able to meet monthly is the ability to connect with other like-minded young adults and create real friendships along the way. We also contributed to the terms of reference as a team at the beginning, and we were able to provide our suggestions for reviews. We each completed involvement matrices, which I'll touch on in a little bit more detail just next, that allowed each of us to identify both which parts of the research we were hoping to contribute to most and what our contributions would look like. In a related way, we also listed our strengths and skills that we bring that we update regularly as the project unfolds. So as I mentioned, the involvement matrix we each completed was done using this tool. Along the top row of the tool identifies various roles we could take on in different areas of the project, and along the first column is space for each of the tasks at various stages of the project where we could contribute to. So for example, with my matrices that you see here, I listed that I would want to act as both an advisor and partner when it came to recruitment praise of the project, because I was very interested in being able to have a hand in the creation of outreach tools. Using the involvement matrix tool was a very helpful overall tool for all of us because it allowed us to visualize different stages of the project and how we personally could fit into the tasks tangibly. It really allowed me personally to shape my role and how it would look like and how much involvement I would want to give certain areas of the project. This is again an example of a list of my identified strengths and skills from the charts that we create and update. I feel that being able to take the time to be mindful of this as a group was really helpful for us not only to self-reflect, but also to be able to network within our group for experts of certain skills to partner with them and learn from as we move along. So in facilitating our partnership as members of the YARP, we have become masters of leveraging technology to reach out to each other. We use Zoom for all of our meetings, which has been very helpful, both because of the pandemic and because members of the YARP, like myself, are in different provinces, and it allows us to connect as a group. We also take advantage of WhatsApp Messenger to stay connected between meetings and keep all of our shared files and contributions digitally on a shared Google Drive, along with other educational resources and meeting minutes. Each of us also truly enjoy the peer-to-peer connection aspect that comes with our partnership, and we have benefited from being able to learn from one another. This is also, of course, the benefit of being compensated too, as members of the YARP. We are also given the choice in our compensation from e-gift cards to stores of our choosing or honorariums of up to 3 hours a month. There's also the non-monetary ways that we are contributed for our mentorship with Brooke, and opportunities to co-present like I am today, and opportunities for co-authorships on future publications. So some of the key tasks of the YARP that we've contributed on are developing the logo that you see at the top right corner of your screen for the READY2EXIT project, providing ongoing patient input perspective on collected data, which looks like reflecting on whether certain specific mental health diagnoses should be included in the project, reflecting on the track tool that Brooke will talk about in just a moment, and breaking down the reasoning behind certain scores. We also work alongside Brooke as equals on both the interview guide for the project and the recruitment language and materials used to often used to connect us all together without Brooke's presence. We also help with understanding the qualitative data by using our lived experience as a lens to support Brooke and her co-researchers interpreting our results. And we develop youth-friendly knowledge translation tools such as infographics and social media posts. Brooke has truly allowed each of us the freedom to contribute authentically and at our own pace, despite having key targets of our involvement, which allows for the process to be really youth-driven.
Thank you so much, Marcella. So now I'm going to talk a little bit about phase 1, the quantitative component of READY2EXIT. This phase of the project uses a tool called the TRACK, which is the Transition Readiness Assessment Questionnaire. This is a 20-item validated self-report scale, which measures health-related knowledge and self-management skills amongst youth with chronic conditions. It's scored on a scale from 1 to 5, with 5 indicating better readiness for transition, and has a list of questions relating to 5 specific subscales, which are listed here and include managing medications, talking with providers, and appointment keeping, for example. In phase 1 of this project, we're comparing the TRACK scores of youth with chronic health conditions only to those of youth with chronic health and mental health conditions to see whether there are similarities or differences between these two groups. And I'm thrilled to be able to share some preliminary findings here. On the left of this table, we see the TRACK score overall and the titles of the 5 subscales I mentioned on the previous slide. In the center column of this table, we see the median TRACK scores overall and across each of the 5 subscales for a sample of youth with chronic health conditions only, And then on the far right of the table are the median track scores for a sample of youth with co-occurring health and mental health issues. Now, while the scores appear quite similar between these two cohorts, interestingly, our analysis reveals that youth with health and mental health issues score slightly higher on the track overall, but lower on the appointment keeping subscale compared to those with health conditions only. These results will inform the types of questions we ask youth participants in phase 2, the qualitative arm of the Ready to Exit study. Our aim in the qualitative phase of Ready to Exit is to expand on, enhance, and explain the results of phase 1, and we'll do this by conducting individual phone or Zoom interviews using a semi-structured interview guide that was co-designed with the YARP. We plan to interview between 10 to 15 youth with health and mental health issues, and recruitment is currently in progress. And the focus of the interviews will be on preparing for transition and coping with simultaneous physical and mental health concerns. Our analytic approach will be called qualitative description.
So within phase 2, the YARP contributed by reviewing the interview guide, as Brooke mentioned, that the researchers will be using during the meetings with participants. In doing so, we were able to highlight suggestions for reframing of questions to ensure that the questions were youth patient friendly, holistically based, and specific. For instance, we advocated for, can you tell me about a time when your health condition impacted your mental health? To, can you tell me one specific story or instance when you felt like your health condition impacted your mental health, or vice versa? This provides space for participants to have more control over their answers and implied less that their health condition did impact their mental health. So some of the outputs of our partnership that we've been successful with already is our successes in peer mentorship and creating relationships with each other. We often reflect as a group that we feel very grateful to have learned more from each other than we expected by upkeeping our fun and open environment and from having a lot of trust from Brooke. In a related way, we also have increased our capacity for our knowledge and often are encouraged to share our resources within the group to further our own understanding of the project and beyond. We have also co-authored the manuscript for the project itself, and we co-present often about our experiences with Brooke. And most exciting, we helped with the co-development of a TikTok and Instagram account at the end of last year that has been really successful with over 17,000 views at the last time we checked on our videos across all social media platforms. So in mentioning that, this is a TikTok video that was created by our lovely YARP member, Megan, and posted on our TikTok account as an example of our efforts in supporting our social media presence.
Hi, my name is Megan. I'm one of the young adult research partners on the Ready to Exit study. Today I'm going to be talking about interview guides. An interview guide is a list of topics or questions that Brooke will cover during your interview. They'll help guide your conversation. The Ready to Exit interview guide was co-designed with us, the 5 young adults on the project. That means people close to your age with similar lived experiences helped pick out the questions you'll be asked. We used our own experiences as research participants to help restructure and reword the questions to make them more youth-friendly and easy to understand. We made sure any questions that you'll be asked we would be able to answer if we were being interviewed. If you have any questions or would like more information about getting involved with the study, please feel free to reach out to Brooke.
Fantastic. So now we'll just close by talking about some of the ways we're reflecting on our process of partnering and Ready to Exit. YARP members and myself have the option to complete monthly reflective memos to think about what we're learning along the way. And we also had a guided group reflection over Zoom at the end of 2021 to discuss the highlights from the year, any challenges we faced, and some opportunities for 2022. I'll end by highlighting some of the key lessons we've learned in our first year of partnering and Ready to Exit. First, it's critical to meet each young adult where they're at by providing tailored support and resources based on their existing skills and those they'd like to develop. I've learned the importance of providing different options for compensation and ways for YARP to contribute to the project based on their interests. We've achieved a balance between providing a structured approach where we're really organized while also leaving room for creativity, flexibility, and fun in our partnership. And we've learned the value of our adapting our partnership processes based on the local context we're working in, considering the group's needs, as well as the milestones and deadlines I'm expected to achieve within the confines of a doctoral thesis project. I'd encourage any of you who are doing this kind of work to consider the time, resources, and interests of the group that you're working in and the expectations of members in order to adapt and apply the principles of patient engagement to your own context. I hope we've demonstrated that patient partners can greatly enhance mixed methods doctoral research by contributing their perspectives, insights, and skills. We also think it's important to consider the developmental stage, preferences, and goals of young adults in order to strengthen the process of engagement. We'd like to end by thanking you for listening and acknowledging all of our research team, including our research partners. And at this point, we'll take questions. Thank you so much for your time.